Good morning, everybody. We're going to go ahead and get started. Thanks so much for joining us today. My name is Aaron Gonzales. I'm the co-executive director at the Catalogue for Philanthropy. Just want to say how excited we are to have everybody join us today for our first annual National Small Nonprofit Summit. We're excited to have so many wonderful organizations represented here today and have the opportunity to learn from one another and hopefully make us all a little bit more successful in the coming year. One of the things we hear all the time about our workshops and our interactive webinars is that in addition to the content that we share, people value and find incredibly helpful the conversations and the opportunity they're able to have to connect with their peers and other nonprofits. So that's exactly what we're going to do here today. It's going to be a peer-to-peer conversation about strategizing and planning in the midst of COVID-19. And when I say strategy and planning, that's everything from not only fundraising and communications, but also operationally, budget-wise, managing staff, anything that is touched by the pandemic that might be affected in terms of your planning and strategy for the coming year. So what I'm going to do, I'm going to pose a couple of questions to get started, and then I'll break us out into smaller groups to have conversations about those questions. Of course, if you get onto other related topics, that's absolutely fine. These are really just a way for us to share some of the questions that we're hearing and help get the conversation started. So I'm going to put these questions in the chat. If you give me 1 second, make sure I'm sending it to everybody. So the first couple of things we're going to talk about are how has your fundraising strategy changed as a result of the pandemic? And which revenue channels do you expect will do well and which ones do you not expect to do well? I'm going to break everybody out in the groups and then I'll give you 10 minutes to kind of discuss these topics and anything else that comes on related to them. During this first breakout, I would suggest you take a minute to introduce yourselves and your organization, and then you can jump into a conversation about these topics. So I'm going to go ahead and break us out. And then once we come back, I'm going to ask for volunteers from each group to share a little bit about the highlights of your discussion and any really good ideas or strategies that came out of it. All right, I'm going to go ahead and break us out in the group, and I'll see you all back here in about 10 minutes. All right, welcome back, everybody. I hope we all had some good, lively conversations. I'm going to ask for volunteers from each group to share a little bit about the highlights of the conversation and any key points or strategies that came out of it. And when you start out, please take a minute to introduce yourself and your organization. Do I have any takers as the first volunteer?
I will go because I always will. I'm Andrea Kempner. Seen you for quite a while, but I was in breakout room 5 with Shannon and Patrick and Sharif and Molly, and we were talking about, Shannon and I in particular were talking about our issues or concerns about government funding, because Montgomery County for sure is planning on cutting funds, as we know that probably most government agencies are with the tax base changing. Talked about foundations a bit, and that some of us are finding that foundations are being very good about things that are related to COVID, but maybe not anything else necessarily. Sharifa was concerned about the small businesses that had given previously, and she's concentrating on individual giving. Shannon was concentrating on individual giving, and Patrick actually said that they were working on a back to school idea, which I thought was cool. We were also talking about how to connect with volunteers. And I sent out a letter recently to our volunteers, which was just kind of a, hope everything is good with you and hope you're being connected, and here's what we've been doing. So hopefully they'll also give a little bit.
Mm. No, that's right. It's interesting. I've heard a lot of people say that individual giving is where they're focused right now. What have people heard in their conversations with individual donors? Has there been a sense that people are going to continue to give and give at the same level, or has there been a drop off? What has been something people have kind of seen in that area or in that revenue channel.
This is Carolyn from Broad Futures. We've seen the whole, and we do most of our fundraising in the fall, but we've been reaching out to people to kind of get a feel for it. And those donors of ours who would be high wealth individuals who have family foundations have indicated that we should actually double our asks for those guys in 2020, because a lot of family foundations have come together to commit to actually doubling efforts. As long as you can show you're sustainable, you have to have a plan to show you're sustainable. Otherwise, they're actually going to do the opposite and yank funding.
Right.
But down to then, our smaller donors, like our $500 and under, even $1,000 and under, we've been encouraged to understand they may not be able to give it all.
Right. No, that makes sense. That's definitely in line with what we've seen and what we've heard. Andrea, you mentioned foundation funding, and I know from our conversations with foundations, most of them have done some sort of COVID-19 emergency funding round, but also have indicated that they are still planning on doing their typical Gen Ops and other programmatic funding, perhaps delayed a bit as they shift virtually and as they do their emergency funding. But I haven't heard of anyone in particular who's decided they're going to not do their typical funding this year or next. Has that been the same experience across the board here, or anybody had different signals from foundations?
I have from some smaller foundations, and where I don't have the answer yet, but I've already had the initial calls to say that we might be shifting a focus from our programmatic funding that we've done to just COVID. So then I am trying to tell as an organization for youth serving how what we're doing is so important, and it's very needed, especially during COVID, to kind of advocate how we fall into that new bucket that they're trying to move the foundation to. So it's not every foundation, but there are some that are really because they're limited and smaller, that they're focusing just on COVID emergency relief.
Gotcha. No, that's good to know and good to hear. Yeah, it's definitely been our experience that at least the larger foundations are still doing their typical round, but that makes sense, and it's not surprising to hear that. How about somebody from Group 1? Can you share a little bit about your conversation?
I don't remember my group. What are the group numbers? Can you read some of the names?
Oh, I'm sorry. Sure. Let me pull that up for you. I should have known.
Sarah, I don't remember either. I know we're in the same.
I don't know what number, but we can go.
Yeah, sure. And actually, it turns out you were, let's see. No. It was
Sarah, Jackie, Stephen, Sierra, Carolyn was our group.
Yeah, breakout one was Cynthia, Eliana, Kara, Sarah, Vanessa, and Kushbu.
Well, in Group 1, I mean, one thing that my organization is addressing is how to budget for FY21. We passed a provisional budget in June. My board's getting back together in August to revisit because we work with Montgomery County Public Schools, and it was hard to figure out what our FY21 budget would be when we didn't know what was happening with the school system. And also didn't know what was happening with Montgomery County government support. So we're revisiting our budget, and as we look out 12 to 18 months, we're factoring in possibly tapping reserves and not simply thinking of new funding, but looking at our reserves in the context of sustainability for the next 2 years.
No, it makes sense. We passed the budget. Our fiscal year is July to June. We passed the budget for a fiscal year, but definitely with the board's input, decided we're going to do a check-in both first quarter and mid-year to see, is revenue coming in as expected? Do we need to cut costs somewhere else? And also, that kind of last resort, do we need to tap those reserve funds that we have? So that's definitely something we've heard people doing, and really something that's I think with all the uncertainty out there, it's hard to really plan for what revenue and even expenses are going to look like going forward. So that makes a lot of sense. Anything else from the conversation? Or is that kind of the highlight there? Okay, how about somebody from breakout room 2? There was Holly, Jessica, Catherine, Sarah, Susan, and I don't have a first name for one person in there.
I guess I can start and speak up. We sort of talk from a fundraising perspective, mentioned some of the things that have already been talked about, but some of the really smaller funders sort of gave their money at the beginning of the COVID crisis and have changed their sort of standard grant timing. We talked a lot about when taking events virtually and corporate sponsors and sort of what that's going to look like. I think that was sort of a question that we're all kind of grappling with, is what does a corporate sponsorship now look like in a virtual event? And you guys did well to cover so much. We really kind of got through that and popped back into the main group. So anybody else from my group can jump in if they want.
Sorry about that. I don't know if anybody else feels that way, but when I see that 60-second timer come up, there's anxiety inducing for some reason.
Exactly. Yes.
All right, great. Well, thanks for sharing, Susan. Let's see, breakout room. I think we have 3 and 4 left. Let's go with 3, which was Carolyn, Jackie, Sarah Ellen, Sierra, and Stephen.
So we were 3, Sarah. Yeah. So we didn't have a lot of time either. We were kind of talkative, introducing who we were and kind of what our experiences were. And we talked a little bit. I'm in Florida, and we are a speech and hearing center, nonprofit speech and hearing center, and how the governor shut us down for a few months, and how we had to pivot to teletherapy, and that worked some for us. But we were discussing the fact that my fundraising budget, we start July 1 also, our fiscal year is increased 33% for this year. So it's scary that, you know, in this environment that I have to raise 33% more than I raised last year.
Yeah.
And part of that is because we can't rely on our clinical operations as heavily as we did before, because we're serving even more people with our mission. And everyone that we bring into the clinic, we have to sanitize between patients. We can't run a full staff. The time it takes to get people checked in, et cetera. So the challenges involved in that. What I'm seeing, some of our smaller funders, and when I say smaller, like organizations that do a couple of $1,000s a year, but you depend on them, you know, year over year over year, have gone away because they've had to do away with their fundraisers and the way that they've raised funds, generated funds to give back out to other organizations. We've seen a big shift in like everyone else, COVID. So some of the larger funders that we would go to for capacity type funds are now strictly doing food and shelter and COVID related. And because we are an audiology and a speech language clinic, we're not on that, considered that front line. Which, you know, of course you can argue it, as someone else is saying, arguing it that way. So that's kind of what we're seeing so far. We have city funds that we're still utilizing, we'll utilize into this fiscal year. We hear in October if there'll be additional city funds coming or not. But here it's extremely competitive to get city funds. You just don't get written into the city budget. You have to duke it out for a small pot. So kind of where we are, and we had to postpone / cancel our fundraiser, biggest fundraiser this spring in May, that it brings in about $200,000. So that was a big hit for us, and trying to figure out how we're going to make that up. So
right. No, that makes a lot of sense. Thanks so much for sharing. We at the Catalogue, we don't have government funding, but I've dealt with it before, and I know it's in a normal period. I can't imagine what it's like dealing with it right now with them dealing with their budgets and figuring out what they can and how much they're going to fund. Well, thanks again. I think we have one more room, and then we'll go to our next topic. Breakout room 4 was Anna, Astrid, Brandon, Brenda, Carrie, and Kristen. All right, I'll let you off the hook this time. But
I was late, so I don't think I took notes. So, but I was talking about that all our efforts have been for emergency funding up until now. So we are now kind of starting getting back together and try to think about next year's fundraising. So I'm trying to reimagine what we're going to do, as we cannot do what we have done in the past because we cannot meet and see what other organizations are doing in virtual fundraising and see if that will appeal to us. We are a nonprofit choir, and we have children from K to 12. So I'm here to take notes and figure out what we can do for next year.
Sure. No, it makes a lot of sense. Thank you, Astrid. All right, well, we're going to break out again, and we're going to shift gears a bit in our questions and look at a little bit of what's going on in terms of operations. Specifically, I want people to talk about and consider what, if you're not yet open, if you're in your process of reopening, what your plan is for your offices and how to implement that plan. And also interested in hearing if anybody is changing their office space plan and strategy. Are they reducing office space? Are they going completely virtual? What is the trend out there, or how are people handling those decisions? I'm going to go ahead and put that in the chat so you can see that. Oh, there we go. And then I'm going to break you out into the same groups as before. And then I'll give you 8 or 9 minutes and we'll come back together as a group again. All right, welcome back, everyone. I hope, again, I hope everybody had a good discussion. In the interest of time, I'm not going to go through each group, but ask for volunteers to share some of the highlights of the discussion you had, and any really helpful or useful ideas, suggestions, or insight into operations, office space, things like that. Anybody want to volunteer to go first?
Hi, this is Brenda. I'm with the Alliance for Nonprofits. Only one of our organizations is back operation physically, and that's only been the last 2 or 3 weeks. The others of us are operating through shared office concepts, and that we are still not back physically with those concepts. We are questioning what the office space kind of industry is going to be for us in the future, so that we have to make very cautious decisions about taking on space and taking on additional space. And for example, our nonprofit was getting ready to, planning to open a shared space of our own through a nonprofit incubator. So our board has pulled back on that until we have more information about the impact of the pandemic. So each organization is making its own individual decisions based upon its need for space and when they will open and under what circumstances.
No, thank you. That's definitely been the case for us. I wonder, is there anybody who has decided to go completely virtual for the foreseeable future and decided to not have office space? If so, I'd be interested to hear, how you reached a decision and what kind of the staff and board reaction was to that.
Yes, this is Molly with the ASCR Foundation, and I was sharing with our group that we had originally planned to downgrade our office space and move to a couple more teleworking days pre-pandemic in 2021. So once the pandemic hit, we actually just, and everybody was working virtual anyway, we've made that decision. Wi-Fi turns off on Friday from our office. So we have been trying to figure out how to move in a couple of weeks with the pandemic and move everything to storage. And we'll be virtual for indefinitely until we decide that the need for an office space is necessary and financially it makes sense for us. The decision came down to really honestly just making financial sense and making sure that we were in good financial position this year, but also just possibly not knowing what might happen in 2021. And we were at the end of the lease. The board and staff all thought it was a great decision. I would say the challenges now are that because the decision was made so quickly, we are struggling with trying to figure out how like basic mail works in a completely virtual. So like some of those like really basic things and trying to make those decisions very quickly. So that's been the challenge, but other than that, that's sort of the plan moving forward.
Gotcha. That makes a lot of sense. And I'm curious, is there any plan to, one of the things we considered when we actually made the decision to reduce but not completely do away with office space. And we did that because there was definitely a feeling amongst our staff that there was an added value or element to when we are able to again actually meet in person, even if it's just once a quarter or once a month. Do you have any plans around that, Molly, or do you have any sense of whether or not something you're going to be able to do?
Yes, we are definitely very, so not having an office, I think, has really, like, you know, people are panicking about what to do with Halloween because we have a costume contest, right? So things like that, in addition to obviously mission-based work. So the plan definitely is to have a monthly in-person gathering when we can. I think in between trying to figure out meaningful and fun ways to connect digitally has definitely been a little bit more tricky to feel like we can do that consistently. But the hope is that once everything reopens, that we have at least a monthly gathering, as well as like team meetings in person and those kinds of things as well.
Yeah, oh, that's great. That makes total sense. Anybody else have a, sir, please go ahead.
I was just going to say my daughter, she's not a nonprofit, but one of the things that they have done is that they always had a happy hour, like at 4:30 on Fridays, and they've kept that, except for it's a Zoom, and each week one of the staff people is responsible for coming up with an activity that they have to do, where it includes everybody. Everybody has to tell a story about something, but it's a really good way, I think, for them to connect and to connect on a more personal level. So they do feel a little bit of that connection that they've missed from the office.
Yeah, that's actually, I love that. It's actually interesting. We do the same thing, otherwise, we not necessarily with the activity, but we do have a virtual happy hour every Friday at 4:30. Again, just so everybody can see each other, talk to each other, because it's even easier being fully remote to get into your silos and only talk to those people who you're actually working with, and not necessarily, you know, interact with the other staff members you otherwise would have. So we have about 5 minutes left. I want to actually give us a chance to talk about any other questions or issues that people were thinking about and would like any input or ideas from the group. If somebody has any kind of high level issue related to strategy or planning that they want to talk about, or questions they want to ask, if you want to go ahead and do so now, that would be great.
I actually had brought this up to my small group. I was wondering what everyone's doing about commuting. When we discussed, you know, going back into the office, my organization, Candid, has been basically talking about it being on a volunteer basis at first and phasing in and all of that kind of policy. But the major concern we have is that, especially because we're a big city, a lot of people use public transportation. And that is, you know, a very risky thing to do right now. So I was wondering if anyone else has a similar issue or has a policy in their organization that they think might work or might not work. Any thoughts?
This is Carolyn from Broad Futures. Our staff has just indicated they will not use public transportation, and I think there are ethical and legal problems with requiring people to do so if they're not comfortable. So I think we just have to, I think it's a huge barrier to being able to get back into your office.
Yeah, absolutely. You know, what we ended up doing is we are reopened at what we call basically 50% capacity, meaning only half of our staff can be present in the office at any given time instead of the schedule. We've also made it completely voluntary. There's no requirement that you have to come back to the office. And I think transit is definitely one of the big considerations. You know, for those who live near the office, it might be as easy as a Lyft ride or even driving into the office, so that's feasible. But for others on the staff, it just wasn't, the public transportation was really the only option, and it just wasn't really an option from their perspective from a safety standpoint. So in one case, we actually basically moved computer and all the office equipment to that person's home location, so that they could actually have access to everything they needed and didn't have to take the risk of using the metro or bus or any other public transportation where they didn't feel safe.
I have a question for the group, and that's around employees or contractors or people who work for you who might fit high risk groups and their physical presence or accommodations.
So I can speak to that a little bit. We, Shepherd's Table does have an eye clinic that hasn't been open until, I think it's opening actually, hopefully next week or the week after. But our doctor is Highrisk, and she wasn't comfortable coming in, which we obviously understood. But we actually waited for her to come to us to say, okay, you know, now I think I'm ready. And then we discussed a plan of what she would want us to put into place before she sees patients. You know, we're following sort of the plan of what a lot of the medical offices are doing. So it makes it a little easier to plan and get the supplies and, you know, ask the right questions of the patients and things like that. So we're going to do a test run for a couple weeks, see how it goes. So we're not committing to like okay, we're 100% back. So we're going to see how that goes.
Great, thanks for sharing. It looks like we are about out of time. I want to mention before we close that after the conference, all of these recordings of all these sessions will be available on our website, and I'll send them out to participants as well, so you have it available. I will also make sure there were some good ideas put in the chat that we save that file and share that with you as well, so that you can capture those ideas and have that to refer back to later on. Thank you all again for participating. I hope you found this helpful and got some good ideas. I look forward to seeing you all in other sessions as well. Take care, everybody.